The overall goal of the following experiment is to percutaneously sample pulmonary lung lesions using an electromagnetic navigational guided transthoracic needle. This is achieved by first mapping the target lesion using computed tomography images and navigational software. Next, an electromagnetic navigational guided transthoracic needle is inserted through the chest wall following the virtual path, which allows the proceduralist to reach the target lesion. Then, once in position and stable, a fine needle aspiration is performed, followed by multiple core biopsies using the 20-gauge core needle in order to sufficiently sample the lesion. The results show a successful biopsy of the lung lesion as demonstrated by the pathological analysis of the biopsies.
Demonstrating the navigation-guided percutaneous lung biopsy will be myself and Dr. Sixto Arias, Interventional Pulmonary Fellow at the Johns Hopkins Hospital.
On the day of the procedure, attach the electronic reference point pads to the contralateral hemithorax of the target lesion to minimize pad overlap with the E-TTNA biopsy entrance point. Obtain a baseline inspiratory and expiratory non-contrast chest tomography with 0.5 mm intervals and 0.67 to 1.25 mm thickness as per the manufacturer. After administering anesthesia and performing EBUS-TBNA for mediastinal staging, assemble the tools and instruments shown here for the transthoracic needle aspiration. Place the patient in a supine position similar to that used for chest CT scan imaging acquisition. Using white light bronchoscopy